Hi, Mike Berg, Head of Regulatory and Clinical for Trukera Medical. We just talked about light scatter and how it can affect pre-surgical measurements. This is a very interesting study that was just published talking about post-surgical outcomes. This was a study of 80 patients, 40 normal, 41 hyperosmolar, all monofocal patients with evaluation 1 month post-op. What are the details of the study? Well, the normal osmolar patients, as you can see, were 298, very normal, and on average, the hyperosmolar patients were 321, mild to moderate hyperosmolarity. However, in the slit lamp, both groups basically looked equivalent, both in breakup time and in staining. The important point here is you couldn't differentiate either one of these groups through the slit lamp. However, the outcomes were significantly different. What we see here in the normal osmolar group, you had a spherical equivalence of 0.28 diopters, whereas the hyperosmolar group was a 0.6. In the target, hitting the target, 62% of the normal patients hit the target within a half a diopter, while only 26% of the hyperosmolar patients. And importantly, you didn't have any misses greater than 1 diopter in the normal. However, in the hyperosmolar patients, 10% of the patients missed greater than 1 diopter. Now, what's important is patient satisfaction. That's where the money rests. And what we found here is the satisfaction of the patients were vastly different between the two groups. The blue graph represents the normal osmolar group, patients satisfied, partially satisfied, or dissatisfied, and the orange represents the hyperosmolar group. In fact, the hyperosmolar group had a risk of 7 times more dissatisfaction than the normal osmolar group.